Well, another Thursday morning, and that means we're taking care of business this morning. And joining us is Heidi Wonderling of Keystone Physical Therapy. Heidi, good morning, and good morning to Deb Eckelberger joining us this morning as well. Hi, guys. How are you?
Good morning. Good.
Cheerful, all ready to go?
Absolutely.
Always ready. Always ready. Well, Heidi, before we jump into things, Deb, let's set up today's Taking Care of Business segment.
Well, this makes our 12th segment that we've had, so that was
12.
Good. Even dozen so far, so that's wonderful. Heidi is the physical therapist assistant and the clinic director at Keystone Physical Therapy here, and we have yet to have anyone on our show to talk about the medical practice or the health field, so we're happy to have her join us.
That's
today.
because they would take us away.
Well, yeah.
Yeah, we are indeed certifiable, so
that's right.
What can we say?
Well, Heidi, it's good to have you here this morning. Before we get into what you do, let's learn a little bit about yourself.
All right. I live in Titusville. I have 3 grown children, a 5-year-old granddaughter. My husband and I work right here in town, and that's the best part. We get to work here, see people every day at work, and in and around town, church, and in the community. So we're both really involved in community.
That's fantastic. So let's talk about the job now. Because for you, I think it's more than just a job, isn't it?
I think it is. I think I finally found a way to put everything that I have always done together into one job for one company, and it's good. I work for Keystone Physical Therapy right here in town, and my job as clinic director allows me to treat patients as a PT assistant as well in the clinic part of the time. And then we just rolled in January more marketing in that. So I do a lot of marketing to the physicians and a lot of community outreach programs, both to nonprofit and local businesses, a lot of work conditioning, going into the work sites, and personal training in the clinic, wellness programs, teaching the fitness classes, and partnering with other organizations. So things I did before, but now I can do them all for Keystone Physical Therapy.
So when did you know this is what you want to do? Because, for teachers, you have to like kids. Mm-hmm. For what you do, you have to like people.
Right.
When did you, and of course the health element to it,
right.
When did you finally get everything put together and you knew this is what I want to do?
Recently.
Really? But you, for years, put together. Okay. So go back a little bit and talk about the pieces. What was the first piece?
The first piece, when I was little, my parents had us involved in the local Ys. I grew up in Franklin and involved in the local Ys with gymnastics, cheerleading, volleyball, track, all the different sports. Taught cheerleading and baton when I was in my early 20s. Then when I moved to Titusville, assisted with the band, worked at the senior center. Worked at the Y in Titusville doing gymnastics, and I still am involved in every one, including the Franklin Y through our Keystone location down there. Still involved in all of those organizations, but now through Keystone. So always in the activities, school, and as a youngster, and then when my kids were little, did the same thing with them, and we just kind of, as far as PT assistant, great program down here at Pitt Titusville. I was 14 years out of high school. The kids were in upper elementary school, and I thought, I'll go check that program out. Somebody else wanted me to go with them. They did not end up doing it. I ended up doing it, and took off from there. So I guess I really didn't know I wanted to do physical therapist assistant, but once I did that, got the degree, you can kind of tailor that position to your strengths.
But you've always enjoyed people and working with people.
Always, yeah.
So that has to be great not only for you, but for the patient, because they get somebody who's going to be dedicated to getting them better.
Right, exactly.
All right, so let's talk more about what you do right now.
Okay. Right now, what we're doing with Keystone is, because we have so many locations, we're in neighborhoods, we're close to people's homes. We have 50 Keystone locations in Western Pennsylvania alone. So if people see the Keystone logo and the Keystone name, it's everywhere. They're close by.
And they sponsor the state because it's the Keystone State, right?
That's true. That helps with our name being remembered, doesn't it?
Yeah.
So we do. We have clinics all across the country, but 50 in northwestern Pennsylvania alone, a lot in Erie, Franklin, Slippery Rock, Sandy Lake, Seneca, Butler, all kinds of areas close by. We're located by the dollar store here in town. So what we do is we've recognized the fact that people have high copays, high deductibles, gas prices are high to get to clinics, even if they're close to your home. If you're talking 2 or 3 days a week, it takes some time out of your day, some money. So what we're seeing a lot is people just aren't doing therapy because they're afraid they can't afford it, or they simply can't afford it. So what we're doing is we're trying to offer more programs that are going to put the patient at a self-sufficient level, where we're doing a lot of education. We may see them for 1 or 2 visits and then discharge them with a written home exercise program, our wellness program, personal training program, funnel them into a class locally, the Y Silver sneakers, curves, different things like that. Back to their golfing, back to their garden club, whatever they want to get back into or get into for the first time.
Are people pretty good at following the written instructions, the home program that you prescribe?
No.
Some. Some. Luke is not, he says. In our clinic, we sit down one-on-one with them at that first visit, and we really educate them. Even if they're in therapy 3 days a week, it's not enough. It's not enough. They have to do the things at home. So if they want to get the outcome, they're going to have to put it into it. If they don't, they simply won't get the outcome.
It's probably easier, though, for somebody to slip out of that routine if they're doing it at home compared to coming in.
It is. We find when people are discharged from physical therapy, what they want to do is come in for wellness, but they still ask us to make them an appointment, which is not necessary for wellness, but we'll do it anyway. Okay, we expect to see you in here, Monday and Thursday at 9 a.m., and then they'll come in. We don't really put them on the book, and we don't, but it helps them to say, I have to get there, I have to do this.
There's been and maybe you could talk a little bit about this whole shift in mentality when it comes to the healthcare system and this wellness aspect.
Mm-hmm.
Meadville just opened up Vernon Place, and that is more of a wellness center. So it's not, hospitals aren't that place where you just go because you're sick,
right?
But now it's preventive care, and
right.
And that feeds into what you guys do.
Right, that's the key, preventive, whether it's somebody who's retired, whether it's a pediatric individual, and we see people all the way from infancy on up. Sports, work injuries. I mean, we always think about prevention with work injuries and things, but you want to prevent injuries in sports. You want to prevent injuries when you're golfing. I mean, we've had people out the entire season of golf. I mean, that's a big deal.
Yeah.
It's a huge deal. So we want to prevent. That's the main thing. And we have things that we sell in the clinic now in Keystone that we use with our home exercise programs. But these are actually therapy products. These are what we use for the patients in the clinic, same equipment we use for them. And then when they're ready to be done, or when they no longer have any visits left, or their copays have become too high, we can discharge them. They can purchase a few very reasonably priced products. They're no longer going to have the copayment. They'll have the products forever. And they're exactly the same quality that we've been using. But they're getting us with that. They're not going into a store and somebody saying, this red TheraBand, I really don't know how many pounds of pressure that is compared to the green. We know, we can teach them, we can tell them the progression, they have the instructions. They're not going to hurt themselves if they follow the instructions.
Do you find people are afraid to make that initial call because they're afraid, oh man, I'm just assuming the cost is going to be extraordinary?
And unless they're in pain, we're finding out that we need to get the word out. Don't wait until you're in pain. Come in for an evaluation, or what we offer is complimentary injury consults. We do those in the clinic, take about 10-15 minutes, free of charge. We don't charge the patient, we don't charge their insurance. We're also doing them out in the communities. We're doing them at the Ys, we're doing them at the mall. The first Friday of every month we do them at the Cranberry Mall. We do them anywhere that the organization would like us to provide those. People can just sign a form, come up, get a quick evaluation, complimentary injury screening. It can be for fall risk assessment. It can be if they have pain in their shoulder. Maybe over the weekend they were mowing the lawn.
Mark's a pain in my butt.
We can do a CIC for that.
Oh, thank you.
So we call them freeze for that.
We call them CICs, and they just come in and get a quick injury screening, and then we recommend either the PT eval, a home program, a visit to their doctor. 2 weeks ago, I referred a 9-year-old girl. Her parents had her come in for one. Not in this town, I was in another town doing them, and she was referred to the orthopedic and then to a rheumatologist, and they ended up with a diagnosis that they never would have, one thing led to another, and it was something nobody really expected. So just from that cheerleading event, and having the complimentary injury consult, one thing led to another, and there was an actual diagnosis for her joint pain and swelling.
Wow.
So they're very, very helpful.
So again, just a simple phone call, 10 minutes of your time.
Right.
And what would you say to somebody who wakes up today and says, actually, I'm feeling pretty good? Should they still try to make that appointment and just to get an overall?
I would. For the complimentary injury consult, we can do that to prevent. So somebody that feels really good and has no pain, that's a great time to test. But a lot of people don't realize how much they have issues with balance. They have no pain, but they may be at a fall risk. And I've heard I don't say it a lot, but I've heard people saying you're one fall away from a nursing home, and that's a scary thought. Somebody out there mowing the lawn, golfing, providing for their family, working 40 hours a week plus, and doing activities, trip and fall on something, or have ankle instability, or anything. I mean, a vestibular problem, inner ear problem, which we also do things like that. So yeah, just to come in and get that complimentary injury consult, make sure everything, it's like a tune-up. We do it for our cars, why not?
For your bodies, yeah.
Well, that balance issue is so important. It's something you take so much for granted. I mean, you stand upright and you move, and that's, balance is all part of that. Whoever thinks of it being out of kilter, so.
Exactly.
Well, probably the guy that's
test.
walking between the canyon or the buildings.
Yeah.
You can be replaced.
I can. It's 21 minutes past the hour of 8 o'clock. This is the Morning Drill on Stream Television and the Allegheny News Talk Sports Network. So along with what you do and the products that you have, let's go ahead and talk about some of the things you brought this morning.
Okay, some of the things that we have, our clinic in Titusville specializes in low back pain, amongst other things. But the low back pain, that's a very common one. We have statistics that would just boggle your mind, and that's another show. We have PowerPoint presentations on everything. Lumbar rolls, these add support when you're sitting. A lot of sedentary workers, office workers have low back pain. There's actually more force on the low back when you're sitting. Truck drivers. So we sell the lumbar rolls, the Treat Your Own Back book. We don't just turn you loose with this. We're going to treat you first, show you how to do everything, review it. Then you have this manual. It's a manual just like for your car, like we talked about earlier. It's for you, for your back. We have these wonderful little, these are all TheraBand products. And these are flex bars. They're for wrist strengthening. They can also be for shoulder stability. A lot of professional ball teams, high school, college ball teams, use these for shoulder strengthening. They kind of can mimic a body blade. Very, very reasonable, a lot less expensive than the body blade. The hand exercisers, they're not just a stress ball. These are actually graded from lightest resistance to heaviest resistance. And they're very, very easy to clean and maintain. They don't lose their shape, and those are for grip strength. We also can test grip strength at some of these health fairs and these festivals we do, and you'd be surprised at how many people lose grip strength. And all the medication bottles are childproof. Jars, doorknobs, turning a key, getting into your vehicle. Those are all things people notice that they're having difficulty with. These are TheraPearl ice packs. You can put them in the microwave, though. They can actually be in the microwave as a hot pack or as a cold pack. And the directions are on the back. You don't even need a layer of fabric between the pack and your skin. And they you can't see this one here, but it's a little frog shape. We do pediatrics, so we have little animal shapes. And then we have some that actually strap onto wrist, ankle, knee. The bigger knee ones have the hole in the middle for the kneecap. We also have eye ones that have the openings for the eyes. Get home from work, lay that on your face.
Wow.
Nice ice or heat, whatever you want. And this is the rock and kinese tape. This is really big. We're going to be doing this a lot for the races here in town, the trail races. Rock taping and kinese taping. It's really very good for runners and athletes. It helps with posture. There's so many ways that this can help, and we teach the people how to do that and tape. We have massage rollers, iced foot rollers for plantar fasciitis. That's this one, and different things like BioFreeze, massage cream, all kinds of different things. We can basically set the person up with a wall system for under $30 that they can use their resistance band, put the little stopper in the doorway at any level they want, and virtually make a home gym out of it. So. You
mentioned being out at different places in the community. You talk about athletes here. So is it something that if an organization has an event and they need somebody at a station to maybe offer these services, is that something that you guys do?
Absolutely. We've done the first aid station at the 3-on-3 booth here in Titusville. We'll take care of the little boo-boos, the ice packs, the extra water bottles, the Band-Aids. If it's more severe than that, we take them over to the ambulance, bring the ambulance over to them. We've seen some pretty nasty injuries and just some abrasions, so we do that. Again, we can do stretching and taping at the races, warm-up exercises for things like the walkathon, different events at Pitt. There's a cheerleading event, I think, at the YW. This weekend, golf events. We can do the little samples of BioFreeze. These are individual packets. These are available in our office all the time. Anytime we're open, you can come in and get these. If you have an event like a golf outing, any organizations want to put these in the golf goodie bags,
That's a good idea. Yeah.
put them in a basket at work in the lunchroom, hand them out to employees, after a rough week. We can give these, we can order these by the thousands, order them by the box, and they're always available. You can come in and say, hey, I'd like 10 packs of BioFreeze, please, the samples, and we'll just hand them to you, and you're on your way. So,
and of course, as this says, provides penetrating, long-lasting relief from arthritis or muscles and joints and back pain.
Yep.
So,
in arthritis, there's a lot of research behind this. With arthritis and inflammation, it works just like ice, and there's a lot of studies and different things. If you go on the TheraBand website, you can actually join the TheraBand Academy for free. You can get research articles, exercises, and we also put people through to that too, so that they have different resources to use when they're in therapy. This is made with natural ingredients, things like green tea, aloe, eucalyptus. So it's very, very good, not harsh on the skin. And it comes in spray, roll-on, different things like that.
I'm reminded, when you talked about the stretching bands and what have you, a couple of years ago, I had a motorcycle accident and it took several months to bring my wrist and what have you back up. My cats were terribly amused by the stretching bands. And they could never figure out what all that stuff was about. And it made me nervous. They just sit and stare at me. And occasionally play tag with it. It's like,
we hear that. Cats, grandchildren, dogs. You get into your exercise routine, and inevitably they're climbing all over you. That's why some people choose to keep up the wellness in the clinic.
I can well imagine.
We don't have the distractions.
and just to clarify, because I have a comment here, a doctor doesn't have to prescribe any, I guess, your services. People can just walk in off the street and get an appointment scheduled.
They can. Every therapy clinic is different. Every state is different. In Pennsylvania, we have what's called direct access. So if the physical therapist has their direct access license, you can be seen for therapy without a doctor's referral. In our clinic, we like to get the doctor's referral and keep them in the loop. It's such a small community. People have follow-up visits. We like the doctor to know. But if the patient comes in for the evaluation first, we send that evaluation within 24 hours to their primary care physician, and they sign off on it, which is called the plan of care. That becomes the prescription. So we're only really seeing them for the evaluation. They can be seen for 30 days depending on their insurance, and then a follow-up. So yes, it is recognized in Pennsylvania. Makes it convenient. So,
talk about, because you spent some time discussing the growth of the company. How about you personally? Where do you want to see yourself in 5 years, 10 years?
I actually like what I'm doing now. And when I started with the marketing, I not only get to go out and do the community events like I like to do, I get to go into the doctor's offices and kind of explain the products to them and how we're utilizing them to help their patients. Particularly, I think in 5 years, I'd like to see myself more involved in the workers' comp and the sports. Those are the two big things that the company's rolling out, and they're developing with TheraBand in our company sports kits, and they're also work kits. And the sports has the whole sports idea has a little playbook. Workers' comp has a workers' comp manual, and again, these are manuals. We go in, do on-site visits, job site analysis, tours of the facility. We can set up better ergonomically. Better workstations and things for the employees. And back to the schools, we have these kits that'll be sold. They come complete with apps for the iPhone, and lots of really, really neat things on the cutting edge. So I'd like to see myself doing the same thing I'm doing, but going out with these new products and really, really showing people what they can do.
I know
really
you probably
exciting.
cringe when you walk into a workplace and you see people at a cubicle or at a desk, and their job is to sit there all day and do what they do. Do you have a plan or something that you can give them that says, if you're sitting here, here's some things you can do that's going to help your body, or you should stand up and walk around every couple 20 minutes.
In fact, last week I was at a local company that has about 90 to 100 employees that sit. And we started out with a PowerPoint presentation, just a few bits of anatomy, the spine, posture. Posture is the biggest thing, whether you're sitting or standing. And we went through that whole thing and then followed up in 2 weeks with a stretching program. So then we did a 10 or 15-minute program at the very end of their lunch, and we have another one in April. So every month we'll go in and do, another one.
Great.
So, but
Heidi, Deb, thank you guys so much for coming in and taking care of business this morning.
Yeah, you're welcome.
Great to see you. Congratulations on everything. And
thank you.
I know that patients love you. You love patients. And
I do.
That's amazing. And again, Deb, another example of great people doing wonderful things here.
Absolutely.
All right.
Glad to have them.
Thanks.
Thanks.
Thank you. Final Look at News coming up next.